All right, welcome to our podcast. I'm Dr. Craig Mortensen, and this is Nurse Jessica. Today we are discussing a little bit about what is functional medicine and, why functional medicine also. So, Nurse Jessica, what is functional medicine?
Functional medicine is really getting to the root cause of pretty much any disease that you can think of. And it's a little bit different from Western medicine in the fact that we don't put a Band-Aid on anything. And we really test and understand what is causing that root cause, and that is how we get there.
Okay, so this was not in our script, but what testing do we do?
We really like to start out with blood work. That really gives us a little idea of exactly how your body is functioning, some of the deficiencies you may have. Another test that we really enjoy is the stool analysis, and that will really get us to deep dive into that gut, which is known as that second brain. We can do more testing, such as heavy metal testing, environmental toxins testing, mycotoxin testing. Oats test is another option we have, along with a few others.
So, what's the difference between the blood testing that we do and the regular doctor, right? Because we get a lot of patients that come in and say, "Oh, I had some blood testing and everything was perfect."
Yeah, we get tons of patients always saying that they're in the normal. They're always in the norm, but they're not feeling normal. And the difference between our functional medicine testing versus their Western medicine testing is that range. Their range is so incredibly big that, yeah, you're going to be in that normal range. And our range is much more narrow. But really, the difference is in the Western medicine world, they get the ranges from sick people. So they are kind of basing it upon you being sick already. And, you may not be sick, or you may, but you're being judged based upon sick people. Functional medicine is we don't want you to get there. We don't want to start treating you, until you get there. We really want to help you feel well and really teach you health. So we base it upon a much more narrow range.
Right. And I always describe to patients like they're also not taking into account what's your normal, right? Like
Exactly.
testosterone, right, could be, depending on the labs, 250 to 1100 for normal, right? And if somebody was, 1,000 before and now they're 300, well, technically they're normal, but they're a third of what they used to be.
Exactly. And they're not going to feel well.
Right. So you were at one point a patient of mine.
Yep.
And I ended up hiring you because I liked you so much. So what led you to functional medicine?
Really, what led me, like most people, honestly, is finding out that that Western medicine world just wasn't giving me what I was asking for. I was pretty much, I think, at my lowest. And I remember calling my mom and just letting her know, Mom, I cannot do this anymore. And I've got 5 kids and a husband. And obviously that, wasn't the best mindset at the time, but I went to the ER and I begged them to find out what was wrong with me. And of course, they do the normal testing, and the blood work came back normal. And he wanted to hydrate me and gave me a CT scan. I mean, I legit thought I had a brain tumor.
Right.
But of course, they found nothing, and they wanted to give me an antidepressant or anti-anxiety because they thought I was crazy.
And whenever they can't
And
find something, that's their kind of go-to.
that's literally
Yeah.
their go-to. I don't know what's wrong with you. Oh, you must be crazy. And so after like that point, like I said, I was pretty much at the lowest, and I called my mom, and I was already getting into the functional medicine world per se, because I was really wanting to start a health coaching business for women in general. Obviously, that's my forte. So I kind of had dipped my toe in it already. So I had a good idea about it. And literally that day, my mom's like, do whatever you need to do and I'll help you. And I pretty much literally that day Googled, functional medicine in my area, came up with 2 options. Obviously loved everything about the website with you, gave you a call, happened to get Kristen, and
My
that's just
wife.
what landed me. Yes,
Yeah.
your wife.
She's my biggest advocate.
Who runs the place, let's be honest.
Yeah, she does.
And she really just heard me through the phone in my moment of despair. And I was like, I can't wait for a June appointment. I have to see him now.
Because it was a couple months wait, I think, at the time, right?
It was, yeah. No, it was definitely, I think I originally saw you in March or April, and she was telling me June. And I literally started crying over the phone, and I was like, I can't wait that long. I need help right now. And she went through your schedule. I don't know if she fit me in or she squeezed me in or made you take more patients because of me, but she fit me in that day at 3 p.m., filled out your questionnaire, and came right over to see you.
And kind of a little bit of a background, without giving too much information, you work in the industry. Like you're in conventional medicine. You're still there currently, trying to get out. And you work for a company that rhymes with Schmeiser.
Yes, I do.
So you see a lot of the stuff that kind of goes on. Now, I've been on this side of medicine, right? Not that it's like two sides, because functional medicine really is blending those. But I've been on the alternative medicine side of things for a long time. But so, kind of getting into, we talked a little bit about like the main reasons for functional medicine, and you kind of had gone through and made like kind of your top list. So what are those reasons that kind of brought you, and now doing it, what would you say to somebody?
Yeah, definitely functional medicine. Number one, it finds the root cause. I mean, that's my number one. It is very, very personalized care, which, like you said, I work in the Western medicine world too, and it's one size fits all. It doesn't matter if it works for you or not, but here in functional medicine, it is 100% personalized. I kind of already mentioned this before, but we really are about teaching health, aka preventative, and not really waiting until you get sick. So that's another big point. You kind of just mentioned it, where we kind of collab, or we bring both worlds into one. And I really like that about functional medicine. It's not my way or the highway. It's what can make you feel better. And then one of the other ones is it is lifestyle as a medicine. I mean, this is not a quick fix. It's not a Band-Aid. This is us teaching you this lifestyle and hoping that you can age well, which that's what most people are looking for.
Yeah. More about quality versus quantity. I mean, don't get me wrong, quantity is nice, but we all want to live well until that day comes.
The long run. Yeah, exactly. Yeah.
So you kind of mentioned, the goal is kind of preventative and getting people there. So do we also see healthy patients as well?
We do. And I love I call them maintenance patients or healthy patients.
Yeah.
We end up finding something to work on, which is great because we want them at their best. But really with those patients, it's about empowering them. And I say it all the time. This is my motto: knowledge is power. And any new information or new lifestyle, or, teaching them a little bit more about their diet, that is power, that is pure power.
Yeah. And so I kind of have a little diagram that always is kind of like one of the functional medicine, like one of the most common things. So I'm going to show this here real quick, if I can. So, no, looks like it's not going to let me. Anyway, the picture is basically of a tree. So have you seen this diagram? Yeah. So kind of like the top of the tree is like all the different symptoms and kind of I forget who had said it, but a good analogy with conventional medicine versus functional medicine is, right, if your leaves start to go brown, right, and they're basically dying, conventional medicine is spray painting them green.
I love that.
Like, oh, look how nice it is. Yeah. Whereas functional medicine, we're looking at more of the roots and the health and the nutrients and all that stuff to fix the problem.
Love that. Yeah.
So that's kind of the stereotypical functional medicine like logo. So what is functional medicine not?
Functional medicine is not a quick fix. And I know that's just the world that we live in. We still live in fast food. We live in this idea of a pill can get you better. And
Right.
Honestly, a lot of people still come to us with that mindset, and it's
It's hard to
not
break that
that.
mindset too.
Yes,
Yeah.
yes. And the moment I tell them, you're going to have to work, and that's a
Right.
tough idea to kind of swallow. Like, oh, you're not going to give me something to feel better? Well, I'm hoping to help you make you feel better, but you're going to have
Yeah.
to work for this lifestyle. It's out
Yeah.
of the norm. So that's what it's not. It's not a quick fix.
Yeah. And also because a lot of patients are oftentimes by the time they find us, we're the last resort, right? So they've kind of
Yes.
been there, done that, and symptoms are kind of a little bit more severe and prolonged at that point. So you
Yeah.
kind of have to, right, if it's been a snowball of things getting to where they're at, now it's kind of like, okay, now you got to unroll that snowball and kind of
Yeah.
go backwards,
Yep.
which can be difficult for a lot of people.
Yeah.
Yeah.
It's hard.
And is there anybody that you would recommend not do functional medicine?
I honestly don't think I would. I don't think there's anything that you or I really haven't tackled. And that's what there's, never saying that we're going to cure somebody, right?
Right.
Because I mean, that's what a lot of people expect. But
Right.
I really don't think there's anybody that we couldn't handle unless, there's functional medicine. I mean, Western medicine things that we cannot fix, such as like broken bones or,
Right.
things like that where that's absolutely needed. But really, I don't think there's anything that you and I haven't kind of seen before.
Yeah, and it also depends on what are that patient's goals, right? Some
Yeah.
people come in and they're dealing with cancer, God forbid,
Yeah.
and some of them want to do conventional medicine and alternative medicine at the same time. Some don't want to
Right.
do conventional medicine. Um, so our goal is to work with those patients and say, okay, here's kind of your options. What makes sense to you, because
Right.
everybody's individual.
Right. And somebody
So
just,
yeah, go ahead.
yeah, no, somebody asked me just yesterday, I believe. It was a new patient, and she was like, "What is your age range?" And I say, I
Mhm.
see people as young as in the womb, right? We see pregnant patients, and
Yeah.
I see patients as old as on their way out in life. And she asked me, well, how can you do that? And I'm like, it's about quality of life at that point. And it's the family members really trying to help that patient go out the best way that they can.
Right.
So,
I'm going to move my camera here, see if I can get a little bit of a better view of it. So, as let's say, treater, I don't know, is that any better or not?
um, yeah.
Yeah.
Am I
So,
too low?
I'm going to go back up here. So, as a treater, right? So, what's your biggest hang up or biggest issue with patients? And then follow up would be, what do you think the patient's biggest problem is, as far as following through and getting better?
Yeah, I think it's just that they have to put in the work after they come to me.
Yeah.
And again, we're not really used to that. We're used to getting things handed to us. We're used to a pill will fix this, fix that. And
Right.
there's none of that being given. It's I'm giving you skills and I'm giving you lifestyle changes to make. Now you have to make sure you go and do that. And I do my best to
Right.
kind of cater to somebody because I mean, like I said, I have a big family and I, work 2 jobs. So I know all about being busy, but how do I maintain it in my life? Other people should be able to do it as well. So I
Right.
think that's the hardest part, honestly, for people on what was the second part of that? I forgot. Sorry.
Yeah. Oh, well, so I actually think it's the same answer for actually both, right?
Okay.
So from the doctor's perspective or the treater's perspective, I think the hardest part is getting people to do it long enough to make a difference. Because I always tell
Accountability.
patients, um, you know, expect 6 months to 2 years for most of the things that we see. Right? There are some things that are shorter, but
Yeah.
it's not a quick fix.
Yeah. And it's accountability.
Yeah.
And it's hard to understand that it all falls on you. I'm giving you the skills, but it ultimately falls on you to follow through.
Yeah. So another question that we often get is, what's the difference between functional medicine, naturopathic, alternative, homeopathic, right? All
Yeah.
those things. So do you have an answer for this?
I do, because still working in the Western medicine world, people come up to me all the time and, ask me. And I'm like, people use those words interchangeably. But
Mm-hmm.
for me, I still think functional medicine is different in that it finds the root cause, plain and simple. And then I try to explain it to them the best I can. And I think that is what is the difference between all those words. It's functional medicine really finds the root cause.
Right, because even though those other things they kind of all fall under the umbrella of alternative medicine,
Mm-hmm.
they are still they are largely pill for an ill, right?
Mm-hmm.
You have a headache, right, and so instead of taking ibuprofen, you take white willow bark. It's like, well, obviously there's a time and place, but
Mm-hmm.
you still more want to get to the root cause for a lot of these things.
Right.
Let me see. Okay, I think. Do you have any other things to kind of add to this, or any questions for me uh, before we end this podcast here?
I would like to know how you describe functional medicine, because I know how I use it in my
Mhm.
terms. But you've been doing this a lot longer, and I think you've gotten so much feedback that you've probably made your own definition to kind of help people really understand what it is. So I would like to hear your version.
Yeah, so my 30-second commercial or my elevator pitch is this. So functional medicine is a blend between conventional medicine and alternative medicine. And so let me kind of go back here a little bit because this is a little bit uh, because functional medicine is not necessarily a defined thing quite yet.
Mm-hmm.
It is different for each practitioner in practice, and
Right.
so some doctors, I, I don't want to put this poorly, but they claim to do functional medicine, and in my opinion, they're not, right?
Yeah.
Because they are still doing the pill for an ill thing. So
Yeah.
anyway, we're using conventional medicine and alternative medicine. We're using conventional medicine testing, whether it's blood, stool, saliva, hair analysis, whatever the case may be, to evaluate how is your body functioning, or more importantly, how is it dysfunctioning. And then we use evidence-based alternative medicine to address those root cause and hopefully fix and improve whatever's going on. And that's really kind of the basics. And I was kind of looking up some, definitions of functional medicine, and probably the premier, training facility is the IFM, which is where I'm certified, and then that's basically what I use to train you.
Right.
And there's this right kind of same thing, right? Looking at the root cause of disease, each symptom or differential diagnosis maybe one of many contributing to the individual's illness. And a lot of times when people come in and they're used to conventional medicine, they want to know what's their diagnosis, what's the
Mm-hmm.
single thing that's causing my problem,
Yeah.
and it's not a single thing. It's death by 1,000 needles, right?
Yeah.
Um, and then the Cleveland Clinic, they're a really big, well-known functional medicine clinic. They've got a good definition. And then I ran across Wikipedia here, and unfortunately, their definition was not so good. Um,
I think we're taught in school not to use Wikipedia.
no, I know, but unfortunately, a lot of people do.
Oh, yeah.
And so theirs is functional medicine is a form of alternative medicine that encompasses a number of unproven and disproved methods and treatments. It has been described as pseudoscience, quackery, and at its essence, a rebranding of complementary and alternative medicine. So that's to me is totally false
Yeah.
because almost everything that we do is evidence based, right?
Yeah.
And both of us, we always tell patients, don't don't take our word for it. Don't
Right.
take the word of whoever, right?
Mm-hmm.
Go out and do your own research and verify what we're saying, right?
Yeah.
PubMed.org is a great resource for looking at a lot of different research papers that back up a lot of the stuff that we do. Right? I
Yeah.
would say all of the stuff that we do. So.
Yeah.
All right, that is it for today. I would like to invite all of our listeners back. We are starting as part of, we're going to try to make this a regular thing, right? Hopefully
Yes.
weekly, bi-weekly, but
Yep.
our schedules do get pretty busy, so it's kind of hard. But one of the I don't know, what would you say, topics, I guess, or spin-offs of that we're going to do is,
Spin-off.
spin-off. Functional medicine cliff notes.
Yep.
Because everybody's busy. And, there's a lot of good podcasts and videos and, all these different things out there. But finding the time to listen to an hour-long video is tough. So we're going to listen to those, and we're going to condense it into 15 minutes. Now, we went a little bit over on our time here, Jessica, but
we'll try better the next time.
Yeah, maybe by the time I edit it a little bit, I'll shave off a few minutes. But so functional medicine cliff notes is what we will be doing. If anybody has any specific podcasts or YouTube videos or things you'd like us to discuss, then shoot us an email. We can be reached at our website at Premier IFM. That's Institute of Functional Medicine, so IFM.com. And I'm Dr. Craig Mortensen.
And I'm Jessica.
We'll see you next time.
See you guys.